If you are over 50 and your legs have started feeling heavy, cold, numb, or strangely weak, do not brush it off as just aging. Because sometimes your legs are trying to warn you that your blood circulation is getting worse. And the scary part, many people miss the signs for months, even years, because they think it's arthritis, fatigue, bad shoes, or simply getting older. Stay with me because one of the most dangerous warning signs usually shows up during something very ordinary, like walking to the kitchen, climbing stairs, or standing in line. And the biggest mistake people make with circulation problems, I'll explain in a moment. As we get older, our blood vessels do not stay the same. They can become narrower, less flexible, more blocked. And when that happens, your legs and feet are often the first place your body starts sending signals. But here's the surprising part. Those signals are not always dramatic. Sometimes they are quiet. A cramp, a strange chill in one foot, a sore that takes forever to heal, a feeling that your legs are tired for no clear reason. That is why so many people ignore them. And that is exactly why these matters. Because when circulation gets poor, your muscles, skin, and feet are not getting the blood they need. And if that keeps getting worse, the problem does not stay small. It can lead to pain at rest, slow healing wounds, infections, and in severe cases, serious tissue damage. Let's start with the first feeling you should never ignore: leg pain or cramping when you walk. This is one of the classic warning signs. You start walking, maybe a few minutes into it your calf begins to ache, or your thigh feels tight, or your legs feel heavy and tired in a way that does not seem normal. Then you stop and rest. And strangely, it gets better. Then when you walk again, it comes back. Most people don't know this, but that pattern is a major red flag for poor blood flow in the legs. Not joint pain, not random soreness. A very specific pattern: pain with movement, relief with rest. That can happen because your muscles need more blood when you walk. If narrowed arteries cannot deliver enough, your legs start complaining. That symptom is often called claudication, and it's one of the most common signs of peripheral artery disease. But here's the surprising part. A lot of people say, "Oh, I just have bad knees," or "It's probably sciatica," or "My legs are stiff because I'm getting older." And yes, sometimes it could be something else. But if the pain reliably shows up when you walk and eases when you stop, do not ignore that pattern. Your body may be showing you a circulation problem before anything more serious happens. And the next sign is even easier to miss. One foot or leg feels colder than the other. This one sounds small, but it matters. If one foot feels noticeably colder, or your toes seem numb, pale, or even slightly bluish, that may mean blood is not reaching that area properly. This is where it gets dangerous, because some people wait until the leg starts hurting badly before taking it seriously. But circulation problems often whisper before they scream. Cold toes, color changes, a pale foot when lifted, a leg that just doesn't feel normal anymore, poor nail growth, less hair growth on the legs. Even smooth, shiny skin can be a clue. That is not normal aging skin in every case. It can be a sign the tissues are not getting healthy blood flow. And if you have diabetes, this becomes even more important. Because diabetes can quietly reduce blood flow to the feet and legs, making sores and infections much harder to heal. That means a small problem can become a big one much faster than people expect. A blister, a cut, a cracked heel, a pressure spot from a shoe. Normally, your body should heal that. But if blood flow is poor, healing slows down. And if healing slows down, infection can move in. That is why one of the most serious circulation warning signs is a wound on the foot or leg that does not heal or heals very slowly. Now let's talk about the third feeling people often brush aside: numbness, tingling, or weakness. Have you ever stood up and thought, "Why do my feet feel dead?" Or maybe your legs feel weak in a strange way. Not just tired, not just sore, but off, unsteady. Maybe even a little pins and needles feeling. Most people don't know this, but poor circulation can sometimes show up like that too. Some people feel numb toes. Some feel weakness when walking. Some say they feel off balance. And because those symptoms can also happen with nerve problems, many people get confused and wait too long. Here's the truth. Not every numb foot means bad circulation. But when numbness comes with coldness, color changes, slow healing, or walking pain, that combination deserves attention. Especially after 50. Especially if you smoke, have high blood pressure, high cholesterol, diabetes, or a history of heart disease. Because these are some of the biggest risk factors for blocked blood flow in the legs. And the biggest mistake people make? They wait for severe pain. They think, if it were serious, I'd know. That is the mistake. Some people with circulation problems have only mild symptoms at first, and some have almost none. That's what makes this so tricky. You do not need dramatic pain for circulation trouble to be real. Now here comes another leg feeling that confuses many people. Swelling. If your ankles swell by the end of the day, if your legs feel heavy, if you notice aching, pressure, or skin changes around the lower legs, that may point more toward a vein problem than an artery problem. And that still matters. Because circulation is not just about arteries bringing blood down. It is also about veins helping blood return back up. When veins are not working well, blood can pool in the legs. That can lead to swelling, heaviness, skin discoloration, itching, and even ulcers over time. So when people say poor circulation, they often mean one of two different problems, artery flow going down or vein flow coming back up. And both can affect how your legs feel every day. But here's the surprising part. The feeling of heavy legs is often dismissed as harmless. People blame long days, heat, shoes, salt. And sometimes that's true. But if swelling keeps happening, or the skin around the ankles becomes darker, tighter, itchier, or harder, do not ignore it. That may be your vein struggling. Now let's pause for a very important warning. If one leg suddenly becomes swollen, painful, red, or warm, that is not something to monitor for 2 weeks and hope for the best. That needs prompt medical attention. Because one-sided swelling with pain and warmth can be a sign of a blood clot in a deep vein. And that is very different from ordinary tired legs. This is where it gets dangerous. People often compare both legs and say, well, maybe I was just sitting too long. No. If one leg suddenly looks or feels clearly different, take that seriously. The same goes for a foot or leg that becomes very cold, pale, blue, or painful at rest. Do not wait around hoping it passes. Now let me tell you the fourth warning sign that often shows up too late. A sore that doesn't heal. This is one of the clearest messages your body can send. A toe wound, a cut on the heel, a sore near the ankle, a small spot that stays open, a scab that keeps coming back. That is not normal, especially if weeks go by and it still looks angry, dark, or infected. Most people don't know this, but slow healing is not just a skin issue. It may be a blood flow issue. And when blood flow is poor, your body cannot deliver what the tissue needs to repair itself well. That is why doctors take non-healing foot and leg wounds seriously, especially in people with diabetes or suspected artery disease. Now you may be thinking, so what should I actually do? Good question. Here's where you take your power back. First, notice patterns. Does the pain come when you walk and stop when you rest? Is one foot colder than the other? Are your toes numb? Do your ankles keep swelling? Do you have skin changes or a sore that won't heal? Write it down. Do not rely on memory. Patterns help doctors see what's really going on. Second, look at your risk factors honestly. Do you smoke? Have diabetes? High blood pressure? High cholesterol? Are you over 60? These things matter because they raise the risk of peripheral artery disease and other circulation problems. Third, do not self-diagnose everything as poor circulation. Sometimes it may be nerve damage, sometimes arthritis, sometimes spine issues, sometimes vein problems instead of artery problems. The point is not to guess better. The point is not to ignore it, But here's the surprising part. One simple test can often help doctors check for artery trouble in the legs. It's called an ankle brachial index, or ABI. It compares blood pressure in your ankle to blood pressure in your arm. Simple, non-invasive, and very useful when circulation is in question. And now for the part many people need to hear most. What helps? Movement. Not endless sitting. Not fear. Not pretending nothing is wrong. Regular walking and supervised exercise can help many people with circulation problems improve how far they can walk and reduce symptoms. Stopping smoking matters enormously. Controlling blood pressure, cholesterol, and diabetes matters. And if you have diabetes, checking your feet every day matters more than you think. CDC, NIDT, NHS. As we get older, small daily habits become bigger health outcomes. A short walk, looking at your feet, not smoking, getting help sooner. These may sound simple, but they can change the whole direction of your health. And if this is helping you see your symptoms more clearly, consider subscribing, because on this channel we break down hidden warning signs in simple language so you can protect your health before small problems turn into big ones. Now let's close the loop. If your legs feel heavy, cramped, cold, numb, weak, swollen, or painfully tired, do not assume it's nothing, especially if the symptoms keep repeating, especially if one leg feels different from the other, especially if you have a sore that won't heal, because yes, your blood circulation may be struggling, and your legs may be trying to tell you before something more serious happens. The signs to remember are simple. Pain when walking that improves with rest. One foot colder, paler, or more numb than the other. Swelling, heaviness, or skin changes in the lower legs. Weakness, tingling, or feeling off balance. And wounds that heal slowly or not at all. That is the message. Do not wait for unbearable pain. Do not wait until the wound gets worse. Do not wait until walking becomes hard. Listen early, act early. Get checked early. Because after 50, the goal is not just to live longer, it's to keep walking, keep moving, keep healing, and keep your independence. And sometimes, saving your circulation starts with one simple choice. Take what your legs are telling you seriously. Before your body has to say it louder,